Now I'm going to go to Ohio and talk to Alice a little bit. Alice and I have been friends forever. I was much older. She was in high school when I first met her, but I think for the most part, Alice, you have been personally touched, but you're also an ophthalmologist. So in terms of what are you doing now? What's your practice doing? I know you're not doing routine cases anymore, so you're not doing your typical LASIK or cataract surgeries. What is your office like in terms of your practice? And tell us how this has touched your life personally.
Yeah, so we've closed our office and our surgery center to emergencies or urgent matters only. So we've had to lay off probably about 120 employees between, the surgery center and our office. So, again, it's pretty, life-changing, to, go from where we were at a month ago to now. I've been really proud of our governor. He actually has been handling Ohio very well. We had the Arnold Classic that was scheduled March 5th, and he closed it to 250 million spectators that are coming in all over the world. He got a lot of criticism for that, but now he's looking pretty good. So, I've had two close relatives test positive for COVID-19. My brother is recuperating at home. My 49-year-old cousin has been in the ICU with ARDS. He is a perfusionist at a major hospital in Cleveland. He does have a comorbidity of asthma, so that puts him at a little bit higher risk level. So he presented about 2 weeks ago with a low-grade fever, similar to the symptoms that he had after a cruise in January, where he had fever, myalgias, cough. That episode lasted about 2 weeks and was attributed to influenza B. He had a persistent headache and sinus congestion. He was working 16-hour shifts. The hospital sent him to a conference in St. Louis. And when he returned, he developed constant diarrhea, passed out in the OR. He was actually doing a case and passed out. He had 102 fever with congestion in his chest. And this was mid-March. The health department turned him down for COVID testing since he hadn't really traveled to any of the high-risk countries. He didn't have a sore throat or a cough. And a few days later, he presented to his local ER, tested negative for influenza B. Chest x-ray showed a bacterial pneumonia, and he also tested positive for COVID, which only took about 12 hours in Cleveland. So he was discharged after about 24 hours with inhalers for his asthma, and then 1 IV dose of azithromycin. About 2 days later, he goes back to the ER in acute respiratory distress. Chest tightness, 105 temp, was delirious, and had O2 sat of about 60. So they thought that they were going to have to intubate him. But after starting him on a combination of hydroxychloroquine and azithromycin, 15 liters of high flow oxygen, and breathing treatments, his O2 sat stabilized. Follow-up chest x-ray on admission showed bilateral viral pneumonitis, and then still the bacterial pneumonia involving his left lower lid, or lower lobe. So even though his SATs were pretty stable during the day, he would drop down back down in the 60s. So every day they threatened him with intubating him. They felt like he was in a cytokine storm, so they started him on a monoclonal antibody or an immunoglobulin. It's an interleukin-6 inhibitor, which is Actimura, which in about 4 hours after he received that, he made a pretty dramatic improvement pulmonary-wise. So, they moved him to a step-down unit. They have since found some blood clots in his legs and his upper extremities. But I think that they're probably going to go ahead and discharge him home on Monday.
Oh, very
So
nice. Very nice.
yeah.